Hey everyone, my name is Colin. I'm a territory manager with Zynex Medical in the Kansas City, Missouri area. Formerly, I was a physical therapist, and so some of my other coworkers have wanted me to put together a quick video of how to fit the osteoarthritis knee brace on your patients, along with talk about maybe some other indications for the brace. And yeah, so I'm just gonna quickly go over it real fast for you guys. When your patient gets the knee brace, it's gonna show up in this bag, and you're gonna get 4 components with it. You're gonna get the brace itself, you're gonna get a key, you're gonna get a non-slip wrap there, and then you're gonna get these knee flexion, knee extension blocks for the joint of the brace. Let's go over the brace first. First thing you're gonna do when you get this out of the box is wanna make sure that it's the correct brace for the correct leg. So up at the top, it'll tell you R for right or L for left. Make sure that's correct first. From there, more than likely, you're gonna have to adjust these straps at every location before it fits correctly on your leg. So let's start there. I'll just show you how to adjust one of these straps because they're all the same, and then we can move on to actually fitting it on the leg. So if you're gonna adjust the strap, you can do it in 2 places. You can do it at the buckle, here at the top, just Velcros over, you can pull it tight. More than likely, you're gonna have to do it at the base. So to do that, you're gonna take off this pad here, which is just used for comfort. It's Velcro, you can take it off, but we'll leave it close by, don't lose it. From there, you're gonna un-Velcro the base of this strap, and you'll be able to see now that it can move freely through the base buckle of the strap. So you can pull it to make it longer, shorter, whatever you need. Once you got it where you think you need it, go ahead and re-Velcro that and replace the pad on top. And you're going to do that for every strap. From there, you're going to line the joint of the brace up with the joint space of your knee. You want it on the lateral side there. Don't try to put it on the medial side, it's not made for that. You want it on the lateral side. You don't want it too low or too high. It should fit nice and snug there on that lateral component of your knee. Each brace or each strap comes with a number on it. It says it's 1, 2, 3, and 4. That is the order in which you're gonna buckle these up so that the brace stays on your leg when you're putting it on. This is number 1 because when you buckle it in and pull it tight, it's gonna fit right above the top of your gastroc, but right below your hamstring here. There's a nice little groove there to where it prevents the brace from sliding up or down. So that's the first one you're gonna do. You're gonna move on to number 2 here. Buckle that in. Number 3. I know I'm making this look kind of easy right now. It's already adjusted to my leg. You may have to adjust these straps a couple times before you want to have them where you want them, but you get the idea. Okay, once these are all, the straps are long enough, they're in the right place, they're all tightened accordingly, then we're going to worry about the offloading mechanism of the joint here of the brace. So if you look on the outside here, you can see a little slot here with an in and an out. Those arrows are just talking about which way you're going to turn this key when it's in here to cause the joint to go either in towards the knee or out away from the knee. I want you to imagine if the joint of the brace is going in towards the knee, that means the bottom part of the brace is going to be going out. If the bottom part of the brace is going out, it's going to be pulling your lower leg with it, which in turn would cause some pressure relief or some gapping of the medial compartment of your knee. If you want the joint of the brace to go out, you can imagine that will cause the lower part of the brace to go in. Thus, it's going to take the lower part of your leg in with it as well, and that'll cause some pressure relief or some gapping of the lateral component of your knee. You can also keep it, right in the middle and have no offloading on either side. But most of the time when you have OA, you're going to have one part of the knee that's worse than the other, and so that gives you the ability to offload that side. So we talked about fitting it. We've talked about the joint. I do also want to point out this non-slip wrap here. This is going to go on the bottom part of the brace. It's going to prevent it from sliding up or down, and it's also going to prevent your clothes from snagging on the Velcro of the brace. So all you're going to do is line that Velcro up with the straps there, wrap it around the bottom and over the top, and Velcro it on. You can make that as tight as you want to, and that should prevent it from sliding up or down even more than the straps are already doing. All right, I'm gonna take this all off real fast, and I wanna go over the knee flexion, knee extension blocking components here real fast for you guys, and then we'll be all good. Okay, so every brace comes with this guy. It says flexion and extension at the top, and it gives you different degrees of blocks here on the for the brace. So with this brace, if you look at the joint, this one already has a 0-degree extension block in it. On the opposite side, on the flexion side, it doesn't have anything. So if you're bending the brace, you've got full range of motion of knee flexion, and there's no hyperextension of the knee right now. It stops right at 0. Well, you can adjust that. If you wanted to prevent the patient from getting to 0 degrees of extension and you wanted them to stop 5 degrees short of 0, you would use the 5-degree extension block. You would just switch those out, and then the patient would only get to about right here. And that goes up to, 25 degrees lacking of extension. For flexion, if you didn't want the patient to go past 90 degrees of flexion, you would put the 90-degree flexion block in. And that goes down to 45 degrees. So if you didn't want your patient to go past right about there, then you could use that block for that. In order to put that in, all you're gonna do is take this cushion pad off, it's Velcro. And if you look kind of in there, you can see a small screw. You're just gonna unscrew that. The extension block that's in there will just pop right out, and then you'll take the new one with the screw, put it right back in, screw it up, and you're good to go. Don't forget that pad when you put it back on. And that's that. The block, I don't see that used a ton in osteoarthritis, but say you had a patient who had a meniscus injury, and maybe they had some catching, locking, increased pain after a certain amount of flexion in the knee, you could put a block in there and prevent that patient from further aggravating or causing damage to that meniscal tear before they have arthroscopic surgery or something. But yeah, that is our OA knee brace. Thank you guys for watching, and reach out to your territory managers if you have any other questions. Thanks.